Today, the focus of my presentation is meaning, causes and classification of abnormal behavior. Dear viewers, let us try to understand the meaning of abnormal behavior. Abnormal behavior refers to dysfunctional and socially deviant behaviors that cause personal distress and can be potentially harmful to the self or others. Abnormal behavior, also known as psychopathology or maladaptive behavior, refers to patterns of thoughts, feelings, or actions that significantly deviate from cultural, societal, or statistical norms. Key characteristics of abnormal behavior include deviation from norms. Abnormal behavior is often defined in the context of societal or cultural norms. Behavior that falls outside these norms, such as severe social withdrawal, extreme anxiety, or hallucinations, may be considered abnormal. Dysfunction. It frequently involves dysfunction in an individual's thoughts, emotions, or behaviors, hindering their ability to adapt to their environment or engage in normal activities. 3. Distress. Abnormal behavior often causes emotional distress or suffering for the individual or those around them. This distress can manifest as anxiety, depression, or other negative emotional states. 4. Impairment. Abnormal behavior can impair an individual's ability to meet their daily responsibilities, maintain relationships, or achieve personal goals. This impairment can range from mild to severe. Causes of abnormal behavior. 1. Biological factors. Genetics. Genetic predispositions may increase the risk of certain mental disorders. Neurochemical imbalances. Imbalances in brain neurotransmitters can contribute to abnormal behavior. Brain structure. Structural abnormalities or injuries to the brain can lead to behavioral changes. 2. Psychological factors. Trauma. Past traumas, including abuse or neglect, can lead to psychological disorders. Cognitive factors. Distorted thought patterns, irrational beliefs, or cognitive biases can contribute to abnormal behavior. Personality factors. Certain personality traits or disorders may predispose individuals to abnormal behavior. 3. Environmental factors. Stress. High levels of chronic stress can trigger or exacerbate abnormal behavior. Social influences, peer pressure, societal expectations, and cultural factors can play a role. Family dynamics. Dysfunctional family environments can contribute to abnormal behavior. Now let us discuss classification of abnormal behavior. 1. Mood disorders. Major depressive disorder. Persistent and severe sadness, loss of interest or pleasure, changes in appetite, sleep disturbances, and feelings of worthlessness. Bipolar disorder. Cycles of depressive episodes followed by manic or hypomanic episodes characterized by elevated mood, increased energy, and impulsivity. 2. Anxiety disorders. Generalized anxiety disorder, GAD, excessive worry, restlessness, muscle tension, and irritability over various life events. Panic disorder. Recurrent and unexpected panic attacks, often accompanied by physical symptoms such as heart palpitations and shortness of breath. 3. Obsessive-compulsive and related disorders. Obsessive-compulsive disorder, OCD, intrusive, repetitive, and distressing thoughts, obsessions, followed by compulsive behaviors or mental acts performed to alleviate anxiety. Hoarding disorder. Persistent difficulty discarding possessions, leading to clutter and impaired functioning. 4. Schizophrenia spectrum and other psychotic disorders. Schizophrenia, delusions, hallucinations, disorganized thinking, and impaired social and occupational functioning. Schizoaffective disorder. Features of both schizophrenia and mood disorders, such as depression or mania. 5. Neurodevelopmental disorders. Attention deficit, hyperactivity disorder, ADHD, persistent patterns of inattention, hyperactivity, and impulsivity in children and adults. Autism spectrum disorder, ASD, impairments in social communication and restricted or repetitive behaviors and interests. 6. Personality disorders, borderline personality disorder, instability in relationships, self-image, and emotions, often marked by impulsive and self-destructive behavior. Antisocial personality disorder, persistent disregard for the rights of others, lack of empathy, and engaging in manipulative or illegal activities. 7. Trauma and stressor-related disorders, post-traumatic stress disorder, PTSD, intrusive memories, avoidance of trauma-related cues, negative mood, and hyperarousal following exposure to a traumatic event. Acute stress disorder, similar to PTSD but with a shorter duration, typically occurring within days to weeks after a traumatic event. 8. Substance-related and addictive disorders, alcohol use disorder, problematic alcohol consumption, loss of control, and negative consequences. Opioid use disorder, a pattern of opioid use leading to significant impairment and distress. Thank you. Don't forget to subscribe to my YouTube channel, Education and Teacher Education, at Shouking Bilal.